It is Pride Month, a time to celebrate the LGBTQ+ community and also raise awareness about some of the challenges they face on a daily basis, one being health disparities. So here to talk with us about that, Tyler Traister. He's an assistant professor and director of the undergraduate nursing program at Quinnipiac University. So thank you so much for being here bright and early on a Monday morning.
Of course, thank you so much for having me here.
So for those that don't follow this issue closely, what are some of the health disparities impacting the queer community?
Yeah, sure. So many of the disparities are similar to those of the non-queer folks that are out there, but what we see with them is higher rates of that suicide, mental health concerns that are there related to maybe that bias or stigma that's developing. We see higher rates of substance use that could develop there, and even some cancers. We see higher rates of that, and even violence.
It's all about delivering inclusive care and creating inclusive environments, especially in a medical environment. What can be done to ensure that, and also what are you teaching your students?
Yeah, absolutely. So even this month, we had our physician assistant and nursing students at local prides here, where we were just developing simple initiatives like Narcan training, how to prevent an opioid overdose, even stop the bleed training to prevent if you saw a bystander bleeding. We were able to train over 400 people. We had our students engaging with them, so it's the easiest way is to get our students to work with the community and to get them to see them as people and to learn more about them that's there. And I know Quinnipiac is steadfast in integrating that into our clinical experiences and our classroom educations.
Because there is a stigma affecting this community, especially at the healthcare level. How do you fight that? How do you overcome that?
Yeah, so it starts with that education and opening those experiences with our students. So again, that they can see them as a person that they want to care for, and knowing that in healthcare, we're going to treat everyone the same that seeks our care.
At least in Connecticut, but elsewhere in the news, as the Supreme Court upheld the ban in Tennessee that banned gender-affirming care. It could give the green light for other states to follow suit. What's your reaction to that? What message does that send to the queer community? And also, should Connecticut be prepared to take on new patients as a result of this?
Yeah, for sure. So as Justice Sotomayor said, it's a sad moment for us because we're ignoring years of medical research and policymakers from all of our major medical organizations that support this type of treatment that's out there for trans youth and trans individuals. It does send that chilling message to everyone across the country when we're thinking about it, but fortunately for those who are here in Connecticut, our state legislators and states committed to protecting our trans youth and people and everyone else under that spectrum that we see. And as a safe harbor state with our Safe Harbor Impact Fund, I do know that we may see folks coming here to Connecticut to seek that refuge and care, and other states across the country too that have those type of initiatives that are there. But I think it's an opportunity for us to welcome even more people and to provide that care.
Which is also presenting a great opportunity for the state of Connecticut. How has the teaching method evolved over the years to tailor this kind of teaching and to turn out a workforce that is very prepared for this scenario? Yeah,
so I think we go away from just talking about items in the classroom. One of the awesome things that our School of Social Work at Quinnipiac does is they have an interprofessional transgender health day where they bring in live transgender individuals who we call them authentic, standardized patients that our students are able to interact with and talk to them in a safe environment, so that way when they go out into the clinical field, they feel better prepared to have that conversation that's there. So I think really we've moved into creating those more meaningful and impactful experiences than just checking a box. Which is really great to see.
Yeah. We have all this information on fox61.com, but elsewhere, if people want to look into this and the programs that you're offering, where can they go to get more information?
So you can find information at the Quinnipiac School of Nursing areas there, and then of course the Connecticut State has a ton of resources for LGBTQ+ health, Anchor Health, Yukon Pride. There's so many resources here in Connecticut that people can find.
You really do great work over at Quinnipiac University. So we appreciate you shedding light on the important issue of health disparities. So thank you so much.
Of course.